My name is Usman. You kids should, get vaccinated. It's important.
And I want to stay healthy. I'm encouraging all kids out there to get a vaccine shot too.
Plugging your vaccination.
Come get your vaccine.
Get
Get
vaccinated.
vaccinated.
I want them to be safe because I got mine since January.
Okay.
And my second dose sometime in February. I think it's really important that we all get vaccinated so we can be safe and have our communities be safe as well. So I'm appealing to my fellow Gambians to come out in their numbers and get vaccinated.
Welcome to the Gambia Red Cross Society. We are here today to witness the handing over of medical items to the Gambia Red Cross for onward handing over to the VAD, which is the voluntary aid detachment. They will be embarking on a community health fair. So these are partners or donors who are here to donate these items to the Gambia Red Cross. But before that, I'll quickly want to notify you of the members of the high table. On my right, I have Auntie Rahi Kagbo. She is the treasurer of the VAD. We have Mr. Alassane Senghor. Mr. Alassane Senghor is the Secretary General for the Gambia Red Cross Society. We have a member of the MFH group. Sorry, I didn't get your name. And then we have Dr. Jain. Dr. Jain is the CEO of AfriMed Clinic. You're all welcome to the Gambia Red Cross Society. So I would like to So this is going to be a very quick session. We're also very sorry that we don't have a lot of our staffs here. As you're all aware, today is the inaugural ceremony of the president, and most of our staffs and volunteers are there to offer coverage and first aid services in general. So it's going to be a very brief session. Like I said, these are items that are donated to the Gambia Red Cross Society for onwards handing over to the VAD, who will be embarking on a health fair in the community of Latukunda German on Saturday. Some of the items that are provided from AfriMed, they've supported the VAD with well-equipped first aid boxes. MFH Group have provided assorted medical items. And we have a businessman, Mr. Matal Boy, who donated 2,000 face masks as well. At this juncture, I would like to invite Wahi Kagbo, who is the VAD treasurer, to give us an overview of the VAD and the activities they've been engaging in and the activities they're about to embark on comes Saturday.
Mr. Secretary General, Mr. Jain, the CEO of AfriMed, and representative of the MFH Group. We are the VAD. VAD is the voluntary aid detachment, the senior members of the Gambia Red Cross. Most of us joined the Red Cross when we were very young, but at a certain age, you cannot join the younger ones, compete them in first aid or march passes. So that is the idea of forming the VAD, to come together, join hands, and support the National Society. These are made up of men and women of different professionals in their different daily professional lives, but they find time to come and support the National Society. We've been embarking on different programs and projects within the communities, up country, and within the Greater Banjul area. Some 2 years ago, we had a very successful health fair in Jawara, where over 2,800 patients were seen in a day. We partnered with a group of young Gambian doctors under the name of Chosan that we went with. We went with different medications, and it was a very successful activity. People came out as early as 7 o'clock to assemble. Some were very young and some were very old, and they received a very dignified treatment from the doctors, because some really assured us that for many years they've never seen a doctor in their life. And the service was very appreciated by the communities of Njawara and its surroundings. So it was from there we plan to be doing it yearly, but because of the COVID outbreak, we have a gap of like 2 years. So this year we came up and decided that we will do it at Latikunda, German, surrounded by more than 5 to 6 communities. So we went around soliciting for support within the community and our members' contributions to make this day a success. So today we have AfriMed, MFH Group, and Mr. Boy that came forward to do a little or a gesture that will be well appreciated by the Gambia Red Cross and the VAD to give back to the community of Latikunda German and its environment. On that note, we thank you for coming to our aid to give back to the society. You are all welcome. Thank you very much.
Auntie Lahi, I would like to recognize the presence of the Spanish delegate, Mr. Javier, and Carla Sala. Carla will be replacing Javier in a few weeks' time. You're welcome to the Gambia. The media also present, The Point, the Standard, and Gambia Talent TV. You're all welcome. Thank you very much, Auntie Lahi. Now I would invite Dr. Jai, the CEO of AfriMed, to give a statement. And immediately he delivers his statement, he will hand over the items to the Secretary General, after which the Secretary General will give the vote of thanks to the donors. So you're welcome.
Won't be long. I'm not very good at making speeches, so it'll be very short. The reason why we're here today is because many years ago, I used to be, I was in St. Peter's Primary School, and my brother here was still the Red Cross enthusiastic. He was encouraging us and leading us. So Mr. Senghor has a long history. So, and I could still remember going to my primary school, and Mr. Senghor has been very active in creating and organizing the Red Cross. I think it started around Lamin or so. I mean, then gradually it got. So we appreciate his able leadership, and also all the volunteers. I've seen a lot of faces here who have been with the society for many years. So that was dedication. On our part, we just want to say that the need of healthcare in Gambia, in fact, it is the biggest problem. Healthcare is our biggest need in Gambia, because you can do everything. You can have all your money you need. If you have an accident, if you have a heart attack, outside Brikama up to Basse, you are in a big problem. You are in a big problem. And this includes myself, because I know what's available in Bansang, I know what's available in Buyam. And whenever I'm driving, I get worried. We cannot live like this forever. We have 50 years of independence. Gambia should move above this. And it's possible. It is possible that we can do it. To set up an proper emergency unit, it can happen. To equip an ambulance properly with an ECG, with troponin I, with all these things you need for first aid is possible. It is not magic. one Pajero. Yeah, the one Pajero. The cost is more than what you will need to equip a whole emergency unit in Buyam or in Basse or wherever. It can be done. So when we see our brothers doing their bit to ensure that, it is frustrating also, because you see, it's not only what we are doing. What he's trying to do is to make sure that it is sustained. Mr. Simon alone cannot do everything. They must develop a culture. That's why he's having people like you to continue that culture. That's why we have people from Spain. People from Spain or from Germany cannot come and develop our country. We have to develop this place ourselves. It is difficult, but it's possible. The only that is to develop this culture. And the culture is we develop Brikama or Latrikunda and sustain it. So when you go there, you have a first aid kit that after 3 months, you go to first aid kit is not there. Then you're going back to zero. So we have to teach the people that the first aid kit must have all that is needed. You write away list there, and it lists the number 1, bandage, number 2, iodine, number 7, you put a syringe there. They must be there in 3 months' time. As you said, you don't know when the emergency is going to happen. Who knows? Without that, it's not possible. You must have something sustained. You must have a culture, and you must have leadership to make sure this thing happens. Otherwise, you'll be going round and round and round. The same problem happening time after time. So, really, I think VAD are trying their best. It's a good initiative. It is a start. Wherever we can really take part, we will take part, and we will, because we know, we can see the vision they are looking at, what they want to achieve, or where they want to go. And that is getting the community, putting emergency care in the community, people to look after their own health. We must develop the concept that people must take care of themselves, but they must be educated and shown how to do and help with that. I just give you one recent example. We're seeing now about 40-something group of young men, young people. The oldest of them is about 42. They're doing some tests because they want to go out abroad for some work. 90% of them have high cholesterol. 90%. And the oldest one is 42. You got a 27-year-old Gambian having cholesterol 7.9 triglyceride. And they don't know. So that's it's serious. So our diets are, but people must be tested. People must go and have the test done. So these are very vital. That at least every year, every Gambian should have access to have at least one test in the year. And that is check their sugar, their blood pressure, their urine, minimum. You should be able to do this. So when VAD is trying to do this, you should encourage. And we will, whatever we can do to make sure it's sustained, but it's more than sustainability. A lot of projects, a lot of things that happen within 2 months, 3 months, it all boils down. We must sustain it. And to sustain it is to help the people on the ground there to take it up, to be educated, to be trained, to be supported financially, structurally. A lot of this information they need. People need information, you know, and they need know-how and of course experience so that they can continue and helping themselves. I think I will just say once again, thank you, everybody, and especially the volunteers, people from Spain and other places, people who have been working here voluntarily without pay. It takes a lot of dedication and ambition and hard work. But just want to say, keep it up. It's appreciated. If we don't reward you here, God, somebody will reward you somehow. Thank you. Okay.
they're extending to other communities. And there is a plan to visit Janjambure probably in March to also do a similar activity. Last year it was in Njawara. Saturday it's going to be in Latrikunda, and probably in March it's going to be in Janjambure. So I'm sure we're going to have a lot of support that they will need, and we're going to have a lot of donors that will also respond to those supports to be able to cover the entire country if possible. I will also want to encourage or urge you to inform your families, your relatives, to also come out on Saturday to get this test, because at the end of the day, it's free service. So the series of screening that are going to be conducted, there is also going to be COVID vaccination and testing, during which you're going to have the results on the spot. So this is a very good opportunity to encourage our friends and families to come out on Saturday and benefit from this test. Now I'll invite SG with Dr. Jain, the CEO of AFREME, to hand over the items to the Secretary General. After which MFH Group will also hand over the items that you brought to the Secretary General. Okay. Face mask, diclofenac, folic acid. Cousin is not here, Mr. Mataboy. He's the businessman who donated 2,000 face masks. Please extend our appreciation to Mr. Boy for the kind gesture. Now we'll invite Mr. Alassane Senghor to thank the donors for the gesture they have provided.
And welcome to the Gambia Red Cross. And I must say, extend my sincere appreciation to, first and foremost, the VAD for putting this together. And just to reiterate, the purpose or the objectives of VAD is to allow volunteers to continue providing their professional services through the Red Cross to their communities. And as highlighted by previous speakers, they are all professionals. And I was so pleased to see my brother, Mr. Keta, here, who is a professional orthopedics expert, whose, I think your first training was through the Red Cross. Yes, since 75, through the Red Cross, the Gambia Red Cross. So it shows that he's coming to give back. And also the fact that what Dr. Jain was talking about, sustainability. And sustainability is also linked to building capacities of individuals and communities so that wherever they may be, they'll be able to offer and extend their services to people in need. So thank you, VAD, and thank you, Mr. Keta, for being back, coming back and giving back. And there are many people like you within the VAD who are sitting here, and some of you are not here. Just going back to what Dr. Jain said in terms of the health sector or the health services in terms of emergency. I mean, here, just to confirm what you said, it's possible, everything is possible. If you have the commitment and you know what you want to get at, and then you have the right people and you touch the right buttons. A couple of years ago, I got back to this country and I was sitting here in this office. I had a problem, a health problem. The day before, it was hot. I had a shower, and then I was lying. The AC was on, the fan was on. So I came into the office in the morning. My sides were, I was really having in serious pain. So I jumped in the car with the driver, went to the Serekunda General Hospital, just walk around the ENA. I said, no, I don't think there is anything here. I went to 1 or 2 private clinics around here or hospitals, nothing. So I ended up at your place there. And after that, I thought, yes, something has to be done. And what was to be done was to try and set up something that people can rely on. If there are accidents or there are people taken immediately ill, they can be taken care of with urgency. Having worked outside for over 20-something years and having seen what other Red Cross societies in Kenya, the Kenya Red Cross runs the biggest ambulance service in the country with over 200 ambulances, fully equipped to the standard of ICU. I decided to engage them. And after a few months, in consultation with the Minister of Health, we were able to bring in 1 advanced life support and 1 basic life support ambulances to this country and started what we call G+. During the first wave of the COVID outbreak, there was not much information about COVID, and that's when they needed a compartmentalized ambulance. Luckily, we had 2, and that was what government used, the Minister of Health, we used to support government to transfer cases. Today, I'm glad to say we have 9 ambulances within the pace of 2 years. And some of them are advanced life support to ICU standards. Moving on, we realized that when you take, just to reiterate what you said, you pick up an accident case on the road, you take it to either the Edward Francis Small Hospital or the Serekunda or Buyam or anywhere. The patients would prefer staying in the ambulance than getting off. That's one. Secondly, even if they get off before they access medical assessment, it takes an hour or 2. So where are we as a country? Do we care about lives of people? Do we care about the health and the welfare of the people? I'm not saying the government is not doing, but I think it's everybody's responsibility to ask those questions. Then we decided to set up a small clinic here, which is right in front of you, which is an outpatient, so that when we get cases, we can manage them here until they get to where they have to be referred to. Because lives of people matters a lot for us. And you're talking about sustainability. We created a company called G+, a private company owned by the Gambia Red Cross, to make sure that it's commercial, but it provides services free of charge to those who cannot afford it. But these charges are related to sustainability, because there is no free gift in this world today. Donation, we can get donations like thanks to you, but you have a limit to how much you can donate. So if we want to maintain the quality and the standard of our services, there must be contribution. And this is where the sustainability comes in, because the individuals using the services have to contribute to it. When you go to the hospital, public hospital, you pay to get registration. So it's the same thing that we are doing here to sustain it. And we try to keep the standards, the highest standards of Europeans or American standard at G+. to complement. Notwithstanding, we have supported government, we continue to support government. Today, as we speak, all the ambulances are supporting government in the inauguration, either through their presidential convoy or at the stadium, to ensure that people are safe, and if something happens, we are able to take care. So just to reiterate, I think it's important that what we are going to be doing, you as VAD, should be accompanied by educating and providing information to the communities that you are going to be delivering this. I think it was said here that the most important thing is for people to go out for medical checkups. Today, if I were to ask here amongst the Gambians, how many of us do every 6 months or every year or every 3 months checkup? I'm sure I will get very few of Gambians doing that. Sometimes when you ask them, they even wonder whether you are just making them feel bad. But this is essential. The indicators provided by Dr. Jan is serious. It's really serious. So if you have 40 and you have a greater percentage of them with high cholesterol and so on, at that age bracket, and then you look at the proportion of those people within the communities, our population, this is a catastrophic thing. That's why you have high rates of high blood pressure, diabetes, and many other cancer, you name it, because people don't check. So I'm appealing to VAD, through this process, integrate strongly an aspect of education, health education, information, so that there is some degree of attitudinal change, that people can start thinking differently. So I would like to thank Dr. Jan for the support and the partnership, and also to thank MFH Group, Michelle. He's a good friend and always supporting. You're giving donation for this function, but I think it's the continuation and the beginning of a long-term partnership. Government can't do it all, but above all, it's our people, it's our lives. So therefore, whatever we do, Red Cross cannot claim to be doing it and doing it well without anybody else. So we count on strengthening the partnerships to ensure that we also continue to save lives and also to help our communities. So with those few remarks, once again, thank you, VAD, for initiating this. And we look forward to going to the second level, that is at the Janjanbureh presence. And thanks to the media for coming. You are always with us. Unfortunately, today is not a good day for the media because you are all busy either at the airport or at the stadium. But the ones that are here, we really appreciate your coming. And we look forward to, we've been with you all over the country, launching our water projects and other things that we do. And you have always been there, so I can recognize your faces. Thank you, and thanks to the volunteers and the Spanish Red Cross. And to Carla, welcome. You arrived yesterday. Javier, thank you for your services. Spanish Red Cross is one of our very reliable partners, and we have together delivered water to communities. We have delivered vegetable gardens and small ruminants to women in many parts of the country, and we'll continue to do this. And also COVID. And of course, the EU and Spanish Red Cross for the nice emergency operations center, which we hope will also enhance our preparedness and response. Thank you very much.
Mr. Senga. And thank you very much to each and every one of you for coming. It's been tough, not easy, especially with the VAD going and coming, following up with people to make sure that the Saturday's event becomes a successful one. So thank you, each and every one of you, once again for coming. And we just want to have a group photo here. So if we can all go towards the boxes, then we can have a very nice photo. Thank you very much, the media, as well.
Che Africa. Billaay ñun ñoo metti den dee toog la gëmloo suñ boppa dara te kenn mënut laa wax fu mu jógee. Askan wi